So now if you have done the basics in epidemiology where we talked about rate, ratio, proportions, concepts of mortalities, how to measure mortality, measures of morbidity, incidence, prevalence, now you are eligible to learn about the epidemiological methods. If you are a PG aspirant, if you are aspiring for the postgraduate entrance exam, this is the most 5 by 5 star MCQ topic. This is a very high yield topic. So talking about the epidemiological methods, beta, the epidemiological methods could broadly be classified into two types. We can have observation study designs, or we need to study about the experimental study designs. The observation study designs are very simple, that we will sit with our hands closed. We will see people with risk factor, will they develop disease, yes or no, or people with disease, do they have the risk factor, yes or no. In experimental study designs, you are going to do some intervention. So you give some intervention. These studies are also known as interventional studies. These are also called as interventional study designs. Whereas observation studies, these are common sense, called as the non-intervention study designs. The observation study designs can broadly be further classified into two types. Either we can have a descriptive studies or analytical studies. So descriptive studies, you're going to describe the disease, and analytical studies, you're going to analyze that if you said that this is the risk factor, is this really a risk factor? Okay, that is what is the analytical studies. We are going to study it later on. But in this video module, we are going to talk about the descriptive epidemiology. So let's start about the descriptive epidemiology. First is MCQ number 1. What are the steps in doing descriptive epidemiology? The steps that we follow are these 6 steps that you see. So you have the step number 1, 2, 3, 4, 5, and 6. First step is common sense. You define the population, right? You define the population in terms of like, what is my area that I'm going to see. Next is you define the disease in terms of like, you find out some inclusion criteria, that forced expiratory volume less than this much is called as COPD, or more than this much fasting blood sugar will be COPD. There is inclusion and some exclusion criteria you will set. Some inclusion or the exclusion criteria is set. And then comes the most important aspect of describing the disease. You describe the disease in terms of what? MCQ, you describe in terms of time, place, and person distribution. So you see the time trends, you see the place trends, and you see the person trends, whether it is more in elderly or young. You see whether it is more in rural areas, urban areas, what different areas. Then you see whether it is having short-term or long-term trend. You see all these things. This is what is the focus of the video today. Next is you measure the disease, you compare with the known indices, and you formulate a hypothesis. So this is what you need to learn today. 3 things: time distribution, place distribution, and person distribution. Talking about the time distribution or the time trends. Beta, the time trends can broadly be classified into 3 topics. You need to study about something called as a short-term distribution, also called as the short-term fluctuations, right? Fluctuation is what? Something which increase, decrease. So short-term fluctuations or the short-term trends. We will also talk about some of the long-term fluctuations, long-term trends or the long-term fluctuations. And we also need to talk about the periodic fluctuations. Periodic means which happens again and again. So short-term trends or long-term trends or periodic. The periodic trends are further sub-classified into, you need to study what do you mean by a cyclic trend. Very small, subtle, small difference. Cyclic trend, and what do you mean by a seasonal trend. So what are the cyclic trends and what are the seasonal trends? These are types of the periodic fluctuations. Let us have a first word about the short-term fluctuations. So where are you right now? You are going to study the epidemiological methods and descriptive studies. We are going to study about the short-term fluctuations, that is the time trends. So talking about the short-term trends or the short-term fluctuations, these are also called as outbreaks, or we can label them as epidemics. Outbreaks are usually in smaller areas they are more regional. We don't say that outbreak of a disease in the whole world. We say epidemic or pandemic of the disease in a country. We don't say outbreak. Outbreak is usually restricted to some regional area or smaller area. What do you mean by epidemic? This is a very 5 by 5 star MCQ topic. You could be UG student or PG student. Please note this is important for you. What do you mean by epidemic? If you talk about epidemic, what is the classical definition of epidemic? Epidemic is a rise in a number of cases. This rise could be usually a sudden rise, but it could be a normal rise also. But there is an increase in number of cases. The rise in number of cases, which is more than how much? There has to be some number, right? That is what the MCQ is, which is more than 80% of expected frequency, or which is more than 2 standard deviations of calculated on statistical methods. So what do you mean by epidemic? Please note that epidemic is any sudden rise in increase in number of cases which is more than 2 SD, that is plus 2 SD, right? Or which is more than 80% of the expected frequency, that is what we label as epidemic. Coming back to short-term trends. If you talk about these short-term trends, these short-term fluctuations or the short-term trends, they could be broadly of 2 basic types. So the short-term fluctuations could be of 2 basic types. One is a common source epidemic. So there could be a common source, also called as a point source. Common source, also called as a point source, or there could be a propagated epidemic. Propagated epidemic. Let us talk about the common source epidemic. What do you mean by the common source or the point source epidemic? Talking about the point source epidemic, this could further be classified into single exposure epidemic, or it could be a multiple exposure epidemic. The single exposure epidemic is called as SEPS, or the multiple exposure epidemic is called as MEPS, multiple exposure point source or a single exposure point source. Single exposure point source SEPS or a multiple exposure point source MEPS. So technically you need to talk about 3 things now. So we are going to talk about the point source as SEPS and MEPS, and we need to talk about the propagated epidemic or the PE. So technically we'll talk about the 3 types of epidemics right now. Let us say that we all go to a birthday party, and in the birthday party somehow the food was contaminated. So common sense, how are we going to feel? Everybody is going to get a diarrhea, and after some days or weeks the diarrhea will be okay. So all the cases will happen within how much incubation period? All the cases are going to happen within 1 incubation period. What is this point that I have drawn? What is this? This is what is the average incubation period. This will correspond to the median incubation period. So this is what? This is an example, typical example of single exposure point source. Why SEPS? Because we all went to the birthday party, we all had the food over there, everybody got a diarrhea within 1 week, and then everybody was normal. This single exposure, we don't go to that birthday party again and again and again. So that thing is done, that event is done, it is a single exposure. A classical, another example that is usually given is, let us say that there is a person who's selling idli vada or any dish, pani puri or golgappe outside the hostel. So let us say that this person is selling some idli vada or golgappe outside the hostel, this person, and unfortunately, no offense, like nothing personal, unfortunately, that person was a typhoid carrier or hepatitis A carrier. So of course, what is going to happen? All the girls, adolescent girls or boys also, right? Everybody will go and have pani puri and golgappe every day. So every day people will come and have delicious food over there. So what is going to happen to the people? What is going to happen? Don't you think that the people will get disease and then be okay? Again, some people will get, again some people, again some people, again some people. After some months or weeks, don't you think that the epidemic curve, don't you think that the epidemic curve will can look something like this, that it is going to have a more higher level, than the normal frequency. This is what is epidemic. So what is this classical example? This is what is a multiple exposure point source. Why? Because there are multiple exposures from the point source. Please note, you have to assume that in this multiple exposure point source, when I gave the example of typhoid or hepatitis A or any communicable disease or any disease, you have to assume that there is no person to person transmission. Right? You have to assume that it is a point source only. Just assume. I'm taking an example over here. I'm not quoting the disease. So just the example is that there's a point source, but now from that point source, multiple exposures will happen. Classical, another example which is maybe given in your MCQ books and in your exams also, that there is a well in the gaon, in the village, and the well was somehow contaminated. So people will drink water, go, people will drink water, go, people will drink water, go. So if they all drink from the common source, that is a common source or a point source, and you get it multiple exposure. So now these are different waves. Can you see the two different waves of the SEPs and the MEPs? Now let us take another example. Let us say there is area and that person over there that was having some HIV or some reproductive tract infection, gonorrhea, syphilis, something like that. So now this person is going to spread the infection to 4 or 5 new commercial sex workers. Now the people to whom the infection is there, they will spread to 4 more. So each one will spread to 4 more. So 4 more will spread to 40 more. 40 will spread to 1,000 and 10,000. So how will the epidemic curve look like? It will look like something like this, and then this, and then this. Are you getting it? This phenomena is what is your third type of epidemics that can happen. This is called as a propagated epidemic. This is called as a propagated epidemic. So the one case will cause maybe 20 more cases, 20 will cause 100 more cases, 100 will cause 5,000, 5,000 will cause 20,000. So there is exponential increase. There is exponential increase in number of cases. So these are your 3 types of epidemics. Please note, I have to draw on a single screen if I want to show you what is SEPS. So SEPS is single exposure point source. What is MEPS? MEPS is single exposure multiple sources, multiple exposure single source point source. And what is propagated epidemic? The curve will be above rising. So you have seen propagated epidemic, multiple exposure point source, and single exposure point source. MCQs on these now. If you talk about the first MCQ in single exposure point source, all the cases, common sense MCQ. Now you'll see that how simple the examiners are asking you MCQs. In a single exposure point source, all the cases will occur within how much time? They occur within 1 incubation period or more than 1. In a common sense, they occur within 1 incubation period. In multiple exposure point source, the cases will be more than 1 or less than 1 incubation period. Of course, common sense, more than 1 incubation period is involved, and propagated again more than 1 incubation period. More than 1 incubation period is there for the propagated epidemic. Another point number 2 that is important for you to know is that there is a rise in number of cases in the single exposure point source, and then there is a fall in the number of cases. So there is a rise followed by a fall, all happen within 1 incubation period. No MCQ, but point for you to understand is that there is a rise in cases and there is a fall, right? No MCQ. But the point comes now. That is what the MCQ might be attracting us, that please try to understand that in a multiple exposure point source epidemic, earlier the cases were at this much level. Now the cases have increased to this much level, right? So now try understanding there is a rise. There is a rise in number of cases, but there is no fall. There is a persistence of the number of cases. What is this technical language for the persistence? That is what the examiners will ask you. It is hyperendemic state. Hyperendemic state. Don't you think that the earlier the disease was at lower levels and now the disease started occurring but at higher levels? That is what is hyperendemic. What is endemicity? It is persistent level of presence of a disease in a defined area. That is endemic disease. So that's what you need to remember, beta. Multiple exposure point source will cause hyperendemicity. Coming to the third point, nothing very special. In propagated epidemics, there will be abrupt rise. What is this abrupt rise called as? Medical language, it is called as outbreaks. So technically speaking, there is very exponential increase in number of cases in which of the following: SEPS, MEPS or PE. Of course, exponential increase will be there in propagated epidemics. There is a rapid rise and a rapid fall in which of the following? It is SEPs. There is a rapid rise with almost persistent levels or very slow decline that you see in multiple exposure point source epidemics. Point number 2. Point number 3, in fact, MCQ number 3. Nothing about SEPs. In SEPs, there is a single wave which happens, right? Common sense, there is only one wave. You see, there is only one wave which increases and then it decreases. Common sense, right? There is only one wave. This wave is called as a primary wave. This is called as one wave. This is called as what? This is called as the primary wave. This is called as the primary wave. Whereas in the single exposure point source, can you see these small wavulations? There'll be very small wavulations which will keep on happening. That is called as the secondary waves. So will you see MCQ? Will you see secondary waves in a single exposure point source? Answer is no. The secondary waves will only be seen in multiple exposure point source MEPS, and of course the secondary waves will also be seen in the propagated epidemic. In fact, that's what we are experiencing in COVID also. We saw the first wave, the second wave, the third wave, and the fourth wave. So what is COVID? COVID is propagated epidemic. You have 1%, 1 gives to 40, 40 gives to 1,000. Right? So that's what you need to understand, that the secondary waves are there in the multiple exposure or in the propagative. There is no secondary wave in the single exposure. Point number 4. Last point for you to understand. How will the cases come down in a single exposure point source? The cases are automatically going to come down because it was a single exposure. So the return of cases will be within or around one incubation period. So after one incubation period, the cases have to come down. That is so simple. But the point to be noted is that in a multiple exposure point source, is there a person-to-person transmission? In a propagated epidemic, is there a person-to-person transmission? Answer is that there is. Please note, I showed you this phenomena. That in this, one person is going to transmit to 1 or 5 more, and 5 will transmit to 15. So please note, there is always a person-to-person transmission. But in this case, I told you that assume that there is no person-to-person transmission. Why? Because if there was a person-to-person, then of course the cases would have increased. Are you able to get it? So that is what you need to understand. There is no person-to-person transmission in the multiple exposure point source. It's a point source. Whereas there is a person-to-person transmission in the propagated epidemic. So if you understand this, now tell me that these cases, you can see that the cases are exponentially increasing. Common sense, the cases will increase. The question will come is that when will they come down? When do you think will come down? Because if this is what happens, that every time the case will increase, then the humans will become extinct. There has to be a point after which the return has to be there. So that is what the question is, that even in the multiple exposure point source, there has to be a return. And also in the propagated epidemics, there has to be a return. So what is the reason, like under what situations the cases will actually come down? So please note that in a propagated epidemic, the decline in cases will happen when, that is your MCQ beta, the decline in cases will happen when there is a herd immunity. When the people will start having herd immunity, and also there will be a decline in the cases when or if the people are susceptible population is not available. Susceptible population is no more there. Like either all the susceptible have died, or they have become the cases, or they have become immune. How will you make the susceptible population not available? In very simple words, we call that as vaccination. So if you are vaccinating everyone, or in case there is herd immunity, in those cases, now the exponential cases will start decreasing. The propagated epidemic will start decreasing. Another third phenomena on which the decline of cases is going to depend is based on the density of the susceptible population. If the susceptible population is very far off, that there is no vector in between, or there is no direct contact, or even indirect contact is not there, in those cases, the disease may not spread. So it also depends on the density of population and so many other factors. But from your MCQ important point, exam point of view, you need to remember that the decline in cases will happen when there is herd immunity or there is no susceptible population. That means there is evidence of vaccination. So please note that the propagated epidemic is going to, because there is person to person transmission, there is increase in cases. Now the decline will happen when decline is happening with the herd immunity or with cases of vaccine. So that's what you need to remember. So basically we have done about the time distribution. The time distribution could broadly, if you recall, was divided into a short-term distribution or a short-term trends, then it was the long-term trends, and then it was the periodic trends, periodic trend or the periodic fluctuations. The short-term trends we have discussed in 3 words. We talked about the single exposure point source, we talked about the multiple exposure point source, and we also talked about the propagated epidemics. We also learned what is the definition of epidemics. Now coming to what do you mean by the periodic trends? The periodic trends could be of 2 types. We can have a cyclic trend or we can have a seasonal trend. Seasonal trend or we can have a cyclic trend. What do you mean by cycle? Very subtle, small difference. The cyclic trend is something which will increase and decrease and increase and decrease in cycles. The seasonal trend is also a cyclic trend, but the seasonal is called seasonal because the cycles are associated with the seasons. Cyclic trend will not have a seasonal trend. That's what is the only difference. So cyclic trend means what? Example, direct MCQs, right? So cyclic is something which comes back again and again. Example for this could be beta measles epidemic. Do you know that measles epidemic in the world can happen after every 2 to 3 years? There is a cyclic trend. Measles epidemic may also occur after disasters. Why? Because there is a decrease in the measles vaccination. But measles outbreak are known to occur after every 2 to 3 years. Another example of cyclic trend you can remember is rubella. Rubella has 5 to 7 year of cyclic trend. Another example you can remember is influenza. Influenza, I think we all know, it is 7 to 10 year cyclic trend. It comes back again after 7 to 10 years. Talking about the seasonal trend. Seasonal trend, the diseases which may have a seasonal trend, very simple, common sense to understand that what diseases are more in summers. Don't you think that in summers it is the acute gastroenteritis which is higher? Acute gastroenteritis, enteritis, which is kind of more. Then there is more amount of heat strokes. Because heat stroke is there, there is acute gastroenteritis, there are more chances of dehydrations. In monsoon, what is more in rainy season? Don't you think that in rainy season it is more amount of the vector-borne diseases? VBD stands for the vector-borne diseases like malaria, like lymphatic filariasis, Japanese encephalitis. They are particularly more during the rainy season. Also in rainy season, there is higher chances of road traffic accidents. RTA stands for road traffic accidents. So that is also kind of more during the rainy season. Talking a little bit more about what are more in winter seasons, what do you think? It has been seen that due to more vasoconstriction or due to maybe the lifestyle, it has been seen that maybe the incidence of heart attacks or the myocardial infarction is slightly on a higher side in winters. It is also seen that in winters more amount of respiratory diseases is kind of more pneumonias, and these kind of diseases are more in winters. If you talk about spring, during spring, don't you think that allergies are on higher side? Evidence of like exacerbations, acute exacerbations of bronchial asthmas is kind of more. And many viral diseases are also on the rise during spring season, specifically talking about chickenpox or measles. These happen just before summers. So there are some diseases which have some of the summerish or the winterish or the rainy or the spring season. So that is about the seasonal trends. So for seasons, you can talk about the winter, summers, and so on. So what do you mean by the long-term trends? Beta, the long-term trends, MCQ is only one or two. That long-term trends are called as the secular trends. Long-term trends are called as secular trends. So if you just see the secular trend, just see hear the language that we say. In medical terminology, if you talk about 1800 years and year 2022, we have seen that there has been a secular decline in the plague cases, polio cases, anthrax cases, diphtheria cases. We have seen a secular decline. Secular decline means over many decades. Secular decline means over many decades. Over many decades. So we have seen that over many decades, after some dashak means decade, right? After some decades, we have seen that the disease has been consistently decreasing, or there might be a secular increase. There might be also a secular increase in number of cases of coronary artery disease or diabetes or cancer or hypertension or anything. So that is what we use in terms of when we talk about the long-term fluctuations, the short-term fluctuations, and periodic fluctuations. So that covers your very important topic about time distribution. Next, let us take up is what are the place distributions. Very simple to understand. If what is the place distribution? Place distribution could be some diseases which are more in the rural areas, or they could be more in the urban areas. Like for example, what is more in the rural areas? Common sense, more animal bites, more zoonotic diseases are slightly more. Fungal diseases are more in the rural areas. Again, there is more amount of dermatitis, which is more in the rural areas. Talking about diseases from the urban areas, urban area predominantly we have like disease of the cities or the towns. It is hypertension. Then you have the coronary artery disease. Then you have myocardial infarction. Then you have stroke, right? So all these diabetes mellitus, cancer, so everything is urbanized diseases. So you have some diseases which are more in rural or in urban. Talking about some of the international variations, there are some diseases which are more common in certain parts of the world. For example, very simple to understand, cancer of the cervix or cancer of the cervix is more common in which area? It is more in India. If you talk about diseases like tuberculosis, diabetes mellitus, that is predominantly in India. If you talk about cancer of the breast or lung cancer, it is more in United States or Canada or more in Americas. If you talk about stomach cancer, it was slightly linked with some of the nutritional eating habits and with the more roasted food or barbecued food or maybe smoked food. So stomach cancer was seen more commonly in Japan. So there are certain diseases which are more common, and again you see more amount of Ebola outbreaks. Ebola outbreaks has been linked to Africa. In Africa, it is more associated, closely and strongly associated with the country that is DRC, that is the Democratic Republic of Congo. So for Ebola outbreaks, it was more in this area. Then also, if we talk about the yellow fever disease, please note yellow fever is more in Africa subcontinent. It is also there more, which is in the South America. South America also has slightly higher incidence of yellow fever. So these are some of the diseases which have international variations. In this international variation, it's also imperative, it should also be discussed that diseases which are not there in some areas, for example, talking about yellow fever, it is exotic in this part of the world in India. Please also note that rabies is not there in countries like UK, United Kingdom. UK is not Uttarakhand, right? UK is United Kingdom, London. So in United Kingdom, rabies, it's a rabies-free areas. So there are some diseases which have international variations. Talking about some of the diseases with national variations. National variations. So what are the diseases which have some amount of national variations? So if you just look at this map of India, if I draw many diseases on this map right now, if we talk about Japanese encephalitis, I'm just shading in a yellow color the Japanese encephalitis area. It is more the Japanese encephalitis, please note J. This stands for Japanese encephalitis, and this is also J. It is more in South India, which includes southern part of India, which includes the state of Telangana, it includes state of Karnataka, it includes Tamil Nadu, Kerala, it includes some parts of Maharashtra, along with, very important, for Japanese encephalitis, the outbreaks we have seen in Uttar Pradesh, in Gorakhpur, outbreaks of Japanese encephalitis, along with the total Bihar belt. So why do I say Bihar belt? Please note that Bihar on one side has West Bengal, then it has Chhattisgarh, then it also has Jharkhand near it. Then on the left side you have Uttar Pradesh, and on the right side you will have the northeastern states touching Assam. So this area is what we call as the Bihar belt. So UP plus Bihar plus West Bengal, that is predominantly high in Japanese encephalitis, along with the northeastern states and state of Punjab also. So some areas in Punjab also, that is what is Japanese encephalitis. On the other hand, if you talk about lymphatic filariasis, the lymphatic filariasis is more in very coastal areas. It has a very pinpointed area of distribution. It is along the coastal part of India. That is for lymphatic filariasis. Plus you have in Bihar, Chhattisgarh, West Bengal, all these areas are again lymphatic filariasis, that is in Kerala, Tamil Nadu, Bihar, Odisha, West Bengal, that is for lymphatic filariasis. Next in line, if you talk about the Plasmodium falciparum, please note the red color shaded is for Plasmodium falciparum. It is more in the northeastern states. Next in line, if I just tell you that which are the areas which are more important for goiter. See, goiter in India, it is predominantly seen in a special area that is called as goiter belt. So that is called as the goiter belt. Where do you see the goiter belt? It is in Himachal Pradesh. There is a small town that is not small, it's a very big area, that is Kangra. So the Kangra, Kangra, Kangra belt is what is the goiter belt. So goiter belt is seen in Himachal Pradesh and Uttarakhand. That is the Kangra belt. Then in the northern part, the cap of India, you see more amount of a cancer that is called as a Kangdi cancer. It is related to use of a Kangdi which is there for heating the body. So Kangdi cancer is there in the state of Jammu and Kashmir. If you talk about malnutrition problem in India, very high amount of malnutrition in India. Malnutrition is specifically seen in the central part of India. Malnutrition is more seen in the central part of India. You can remember it as Bimaru states. Bimaru states, that is Bihar, Madhya Pradesh and Maharashtra. A is Assam. R is Rajasthan. U is Uttar Pradesh. So these are the Bimaru states for malnutrition in India. Next is if we talk about the drug abuse in India. Please note drug abuse, mostly it will be all the metropolitan cities like Delhi, Mumbai, Chennai, Kolkata, metropolitan cities plus the state of Punjab plus few areas in northeastern states which have very high prevalence of HIV, and along with that they have high prevalence of intravenous drug abuse in some of the states in northeastern states about the drug abuse. Talking a little bit more about the central part of India, in the center in Madhya Pradesh you have a special area disease that is neurolathyrism. Neurolathyrism is more in the central part of India. Why? Because the Kesari dal or the Lathyrus sativus, it is more grown in those areas. Those areas are known to have neurolathyrism because of Lathyrus sativus. Next is if we talk about the Kala Azar. I need to take a special pen now because Kala Azar is ultra important. This black color thing is for Kala Azar, beta. This black color area is for Kala Azar. I will write it on a separate area, on a separate page, Kala Azar. So let's take a separate page and write down about the Kala Azar. It had been a previously asked MCQ. Kala Azar is more in the Bihar belt. What do you mean by the Bihar belt? That is Bihar, Uttar Pradesh, West Bengal. It is also more in Jharkhand and Chhattisgarh. If you get one best answer, please note Bihar and West Bengal are known for Kala Azar. That is what is Kala Azar belt in India, Kala Azar area in India. So these can be some of the MCQs regarding the national variations in India. After this, you can also talk about the person distribution. So beta, what we have already discussed is about the time distribution, where we talked about the short-term trends, the long-term trends, and we also talked about the cyclic trends or the periodic trends or the cyclic trends. Then we also discussed about the place distribution. We talked about the national distribution, international distribution, and now we are on the person distribution. In person distribution, the diseases can vary according to the person. So there are some diseases which are more commonly in children. Like for age, if I talk, so in children, what are the diseases which are more common? Needless for me and you to say. Please note, in pneumonias is the most common cause of death. Also, if you talk about disease like measles, it is known to occur in more in under 5 children. If you talk about mumps, on the other hand, it is known to occur age more than under 6, like age more than 6 years, usually in the preschool age group. If you talk about rubella, if you talk about rubella has a problem in developing countries. In which countries? Developing countries. In developing countries, the rubella age incidence is 3 years to 10 years, whereas in the developed countries, the age incidence, can you believe, is more than 14 years. So that is why the rubella is becoming a problem in most of the developed countries, because in case it affects a young female who is going to be pregnant, now there are higher chances of CRS, congenital rubella syndrome. So there are certain age predilections also. Also, you would like to remember that for age, you can also remember about Hodgkin's disease. Hodgkin's lymphoma, that is more predominantly seen in particular age group, like age at 20 years and at 70 years, there is a bimodal age presentation. Talking about age is like cancers, they will have always, cancer is more in 4th or 5th decades. Coronary artery disease will also have a age distribution because it is more seen only after age of 40. So that is about the age distribution. We can also have sometimes the person distribution based on the marital status. Marital status. It is also seen that people who are married will have a different problems, and people who are unmarried will have different problems. It's like apple, you eat it, you are going to cry. You don't eat, you are still going to cry. So what are the problems in married people? In married people, unfortunately, we have seen a higher amount of depression. In married females, there is also more chances of CA cervix. In married females, there is higher chance of CA cervix. In unmarried people, there is higher chance of reproductive tract infections, sexually transmitted infections. There is more chance of dermatitis in unmarried people. So that's about the marital status. Also, MCQ can come regarding the occupational status. That's important, occupational. That's medically important, occupational status of a person. See, the occupation, very easy to understand. If a person is painter, there are more chances of plumbism. If a person is coal worker, there are more chances of pneumoconiosis. Pneumoconiosis, right? More chances of plumbism. All these are occupation related. All these are occupational related. Also, the gender can also be a person distribution. If you talk about the gender, there could be some diseases which are more in males or some diseases which are more in females. The diseases which are more in male, don't answer me about the prostate cancer and the breast cancer. That is common sense. About the cervical cancer or the ovarian cancer. That is common sense. So talking about the gender predilection, more in males, it has been seen coronary artery disease. It has been seen hypertension is predominantly in males. In females, we have seen a lot of depression, lot of anxiety. Thyroid diseases are known to be there in females. So there are some diseases which have gender predilection also. Also, you can remember about the socioeconomic status. Some diseases will be more in the low socioeconomic status, low SES. SES stands for socio. I'll take a separate page, socio-economic status. So there could be a low socioeconomic status or there could be a high socioeconomic status. So in the low socioeconomic status, we can have more amount of dermatitis. Entirely the diseases which occur in the people with low socioeconomic status, that is entirely different from the diseases which happen in the people from upper classes. So in low socioeconomic status, it is more of the dermatitis and lot of tuberculosis you will get, lot of infections we will get, lot of infections. Whereas in the high SES, there is more amount of very high, lot of coronary artery disease, diabetes mellitus. Then there is cancer, which is a big problem in the upper strata of the society. Also Parkinson's or Alzheimer's disease is more in the upper strata of the society. So that's what it technically means. So, beta, just to summarize what you have done, you have talked about these things. You talked about the time distribution. We talked about the person and the place distribution. In time distribution, we talked about short-term fluctuation, long-term fluctuation, and the periodic fluctuation. Short-term fluctuation was further classified into single exposure point source SEPs or multiple exposure point source MEPs, or it was propagated epidemic. The periodic fluctuations were of two types, cyclic distribution, or we could have the seasonal distributions, and the long-term distribution, these are nothing but the secular trend. Talking about the person distribution, there could be age, gender, and so on. And place distribution we talked was rural or urban. So this is just a very quick summary of what you learned in the descriptive epidemiology. Last point before we close off this video is about the descriptive studies. So what studies would help you in doing the descriptive studies? So the descriptive studies or the descriptive methods could be only two. I don't think the MCQ will be there, but you should know what is this. This is what is we call as the case study, or what we call as the case series. MCQ point, what do you mean by case study? Case study means a single case. So only if a single case was taken, one case, one 40-year-old male comes to us, we try to find out what the disease happened, when did the disease happen, time, place, person distribution. All this is called as case study. In case series, you are going to take multiple cases. Multiple cases will be studied in a case series. So that's the only point for you to know. So with that, we have finished this topic on descriptive epidemiology observation studies. In the next video, we are going to learn about the analytical studies.